in 95 facilities location when we deliver services because there is a large area to cover. And again, we have also private hospitals and elderly and nurses for elderly people. That again is an issue. Again, we take care also about the emergency system with ambulances, helicopters, and so on. We take care also about the public hygiene, vaccination, veterinary, the food control, and the safety at the workplace. And again, we are in charge of that. Again, psychiatric services, all the services for the people that are drug addicted. And also, we take care about healthcare for the prison, for the system of the prison. In Florence, we are one of the biggest prisons in Italy, and we have to take care about that. That is a specific issue without a general issue. This is, again, what we are doing in our company. You see a large company, and again, this is what I struggle with every day. We have to cope with the money. That is 1.650 per euro per year that we receive per person. One thing that is important to say about the approach of Lean and the reorganization is the specific kind of people we are working with. First of all, we are in the public state company. It means we are bringing all the things of not good by itself of the normal we have in the public sector. Bureaucracy, litigation, a lot, too much, I think, self-esteem of our person that think that they work for a company, but they can do what they want normally. A big pressure from union. A big pressure for stakeholders is the community that takes care about the hospital, and there is a continuous pressure. Also, a big pressure from, for instance, suppliers, because we spend a lot of money and all the area. There are a lot of people and companies working with us or for us. There is an enormous social control on that. We are in the newspaper every week. Anything happens in our hospital goes to the local newspapers. And, it's difficult to make things happen. This is the overall things. One important thing is about our people, again, we can say. We have various kinds of people working, mainly nurses and doctors. And speaking about doctors, really, it's not easy to drive and to manage 1,200 doctors, many of them that are very noticeable, famous surgeon or something like that. That is not, the paradigm of the organization has to take care about that because otherwise doesn't work, simply doesn't work. This is one of the additional issues we have to address in order to do something in our sector. Something about the results. We are really, I call that boosting health. It maybe is too much, but we have to say that all the indicators in our area say that the main indicator of the status of the health of the people are going very well. And these are the results of years of work. For instance, in Flores, we have one of the highest life expectation in the world. Somebody said, despite my presence, but anyway, they continue to live and so on. But anyway, we are one of the highest life expectation. That is an issue because people very old, it's an issue for the healthcare system and money. What we can say that despite the cost trend is increasing everywhere, thanks to our strategy that we are going to see, we are coping with targets in both delivery of quality, delivery of results in terms of healthcare results, and we are also coping with the expense and the budget. Every year is more difficult, but anyway, we are coping with the assigned money that we receive for that. Few words about the scenario on the healthcare that is in Italy, but everywhere in the Western world, we can say. That is a big issue for any country. We are in increasing of expectation from our customers in what? In everything. Increasing expectation in clinical results. Everybody expects to be cared and to, let me say, don't die. Let me use this word. And there is expectation on really results, to come out of the hospital in good shape. There is also more expectation in less response time and in customer satisfaction about customer care in general, information, accommodations, and so on. And again, there is an increase of everything. There is an increase in demand also in quality and quantity of services, more and more treatments at a high specialization level. Okay, there is also more complex treatments and technologies. Everything, obviously, is increasing in complexity and in cost at the end of the day. A specific issue is the increasing of the elderly people and the chronic diseases, people that are with this, they survive with their own disease for years. That is good, obviously. This is the modern world that goes ahead, but is an issue in terms of organization and cost. And at the end of the day, we have a lot of economic constraints because the financial resources that the government gives to us really don't grow or don't grow enough to crop the growing all the rest. It means day by day or year by year we have a discrepancy between the trend of the cost and the trend of the revenue. And this is a big issue everywhere in the world, also for my company, also for me. This is the scenario. Now, in order to cope with all these difficulties, years ago, we will see later, 5 years ago, we decided to put in place a new strategy, a lean strategy. After a few experiments of lean best practice, we decided that to change the approach, to have a broad approach to the overall company. That means organization, best practice, everything. Because the idea was, or is, to change, to do a turnaround of our paradigm, our organization that was set 100 years ago and more or less is the same, same organization in hospital, to do something new in order to increase quality, increase production, and cope with all the problems we have in financials and so on. In fact, we said we had to put a lean strategy to survive and prosper. Also, prosper is an important thing because the message that I would like to give to our people is that we are not doing that to save money. Yes, we save money. But the problem is to put in place something that we can expand ourselves, we can expand our company. We can expand the opportunities of the people and the opportunities of the clients or the patients. Survive and prosper are two important words in that as a message. And in what? Obviously, in re-engineering all the process, develop tools, managerial tools, a lot of managerial tools, and doing a kind of optimization, both at macro level and the micro level, obviously, continuously optimization. What? The hospital processes, also what we call the primary care process, what is not in the hospital, what is at home, that is important. All the administration processes, we have plenty of administration issues in the hospital, and again that, and work in the governance, in the managerial approach. Obviously, we have to work with the human resources and the management, as we have seen this morning, really. This is the strategy. And the strategy we can see here in this matrix, how we put in place this strategy. First of all, developing, working on the processes. Both in the hospital and the admin, put the re-engineering of all the processes, organize the company by process with a lean approach. And put in care a specific program for customer care that is something that is important. We develop tools. Tools are, for instance, we have an integrated, unique clinical record system that is not easy. Only in the world, 10–15% of the hospital have that, no more. And seems strange, but it's something that is very important, and develop also a lot of other tools, managerial tools and electronic tools. We work a lot on the human resources. We'll see a specific slide on that because it's our really added value is the work of our doctors, the work of our nurses. And it is important to work with them. And we put in place a governance system that goes from auditing, certification of the balance sheet, the system of planning and control, and what I call lean management because we are the Lean Academy, but this is we put in place something to arrive one day to say we have a lean management in that. This is an overall strategy. What I like to say is we tried to redesign completely the company with this approach and doing a lot of things, but in this global drawing. And at the end, we launch a deep, large, and comprehensive re-engineering program with the principle of the lean value stream analysis for the patient. That is easy to say, but I will say later is extremely difficult to try to do. With the lean organization principle and working with the people. And we put in place this large program that we have also is called OLA, A, that means lean organization of the systems, has its own logo. There is a specific site on the web that we can go there. You know, we have also T-shirts with written that. Also, we did a kind of advertising of that project. Now, this is a complete picture. We will go through each of these. I try to show you the main things we have done in this project, in this reorganization. Going through these charts. First of all, it seems simple, but has been very difficult. In each of the 6 hospitals, we have departments, small departments, surgery, cardiology, and so on. Each department has its own rooms, its own beds, 20 beds, its own nurses, 20 nurses, its own doctors, its own technicians, its own clerical people. And we have more than 100, 120 small departments, small departments around the company, because it's a large company. We cut that completely. Now we have only 9 large departments overlooking all the company, and we abolish these small wards, because a small department in an hospital is a small ward. There is a door, and in the other side of the door there is the boss, and he is the owner, was the owner. Now we cut completely that. In each hospital we have only 2 large areas, that is surgical and non-surgical, and so on. The nursery are not owned by each department, but are part of the system. And this is believe me, it was a nightmare. Because when I cut this department, here there is one guy that spent 35 years of his life to reach this post, to be a noticeable surgeon, to say this is my territory, here I'm the owner. This is part of the mentality of the hospitals. And to cut them and say, okay, good, you are a very good surgeon, but now we have to work in a process, believe me, it's not easy. It's not easy. Anyway, this is done, and now it's done 2 or 3 years ago. Now is in place that. This is the first important thing we did. Very, very strong, very tough. At that time, we arrived at a kind of little crisis with my people by saying we have to go ahead. I'll tell you something about that. This is the first one. The second, we work on process. This is the real case. It's one surgical patient in one of our hospitals in Florence, 2007. This is the trip that this guy has to do from home to home for a small surgical operation, nothing special. We used to force, and this is typical of the public sector really, also in various other administrations of the public sector, we force our patient, our people, our customer, to go through one organization that reflects the need of the organization itself, and not the need of the customer. And it's just typical really of the public sector, of the state sector, and so on. And also the big company, if you leave the organization alone, after 2 or 3 years, tries to organize them itself in such a way. Anyway, this is the part, we work on that. We redesign completely all the flows with the best practice that we are speaking about. All the principle of the lean has been applied with really everything has been done in the right way, let me say. And we design the hospital, dividing the hospital not by department, but by process and product line. I'll show you something. Applying the concept of the model line, when this is the part of the patient, everything has to support it. We will design our department in all the hospitals in such a way, we divide in 6, there are no departments I told you, we divide in 6 patient flow in 6 big processes that are surgery and emergency surgery, eye care and low care medical, outpatient and obstetrics. We redesigned completely, and we moved the organization around these flows. Any department now, intensive care, medical imaging, gives services, let me say, or gives support to that one. Again, it's easy to say, but it was really a long journey. We'll see something about the line. We also put line managers. Each line, through each hospital, but also through the 6 hospitals, through the company, is managed by what we call line managers. We hire these young line managers that are engineers, like me, are not nurses, not doctors, but we hire engineers that particularly skilled in scheduling, in process flow, and so on, and they are the owner of the process. And again, this is something that was an innovation, but it works. It's 4 years that is working that. This is another large change of our organization. And again, there are in this organization changing 50% of our 7,000 people, 4,000 people that are, have been moved in this organization. Another thing is important, the work of the nurses. This is the classical spaghetti charts, and we checked these 2 nurses, Anna and Paolo, what during one morning, what they are doing, or what they were doing. As I also can see, you spend a lot of time in the corridor and less time in the room. But the sellable time, the added value time is in the room when they do something for the patient. Again, this is part of the organization, the location of the areas, and so on and so on. And this is very common in a lot of hospitals in Italy. 90% of the hospitals in Italy have this kind of situation. We studied, we did hundreds of these charts, really, and we review the model of the room work, introducing another model after the line model, the cell model, the production cell model. And we'll see. This is an example of typical material flow. Just here is an hydraulic valve for something. This is a typical approach of redesign of the manufacturing flow with the cell principle. You know very well that is part of the accepted theories. Okay, we applied this concept to the beds, and we can see here that we put in place the production cell model, where there are 12 beds with 2 nurses. One is the main nurse, another one is the junior nurse, let me say, less skilled and with a less minor level in the professionality. And they do the complete work to these 12 beds. Before, there were a lot of beds, and there was one nurse that came with medication, another with doing services, another doing cleaning, another doing starting again. This is a typical, batch system and so on. Now we do the integrated job, and these 2, they work together. And also in the cell of 12 beds, we mix the patient in terms of gravity. That is, we'll balance the workload of the people. Also, this kind of thing needs scheduling. In fact, we design a specific scheduling system, and there are these engineers that continuously, they did the mix of the patient on the line and based on gravity. And this is another big issue that we have done. Also, our architectural department, engineering department, work on that, because as you've seen, we are refurbishing old hospitals. We are building new hospitals, but also we have hospitals that were made in the 60s, 50s, 60s. That is what we have. But with the lean approach, we review completely the layout, discovering, if you apply the stream value analysis, we discovered that there are a lot of rooms that they did not an added value to the patient. One room were there, because I don't know why. Looking each square meters to understand which is the contribution of these square meters to the patient value, at the end we discovered a lot of space. A lot of space, everybody was struggling saying there is not enough space. In fact, we discovered a lot of space. And we redesign the layout with this lean approach, let me say, as I tell you, as part of an overall strategy. Again, we put in place what we have seen this morning. All the activities now is a lot, various times are developed through the A3 approach. We started a couple of years ago with a Six Sigma approach for analysis of variances and so on. And also we put in place a certified path for training in Lean. We have these three, the first level, everybody has to have the first level. Everybody working in the hospital has to pass the first level. The fourth level is for the management at a certain level. Also, we receive a specific financing from the regional government to do a kind of school for this science, for lean science, dedicated to all the people of the healthcare system in the region. We receive a specific financing for that. At the end, we can say that today, we are 70 project team working on something, 5S or other things, with 400 people working. These days, we have that here at the level. And now we are in the phase that the thing is expanding by itself. Today, that is working. Again, here we have the overall timetable. I don't go through, but we are here now. In fact, we are not at the end. We are at the end of the first phase. Now we start again, because never finished that. We are continuously reviewing. Here there is, in 2006, we spent a few months discussing 5-10 people, having project ideas, and we decide to do or not to do. At the end, we decide we start. And during the Christmas holidays, I called all the 150 top managers of the company. I told them, the 5th of January we start. Finish your holidays, and we started this project. And we started, in fact, we never finish. It's, as you can see, is broadly covering all the company. Another important things, the people involved in the project. In this chart, you can see that we started working few people. Now, at the end, more than 800 people are worked in these Kaizen weeks, in this teamwork, everything, for 1 or 2 weeks, giving their support to the project. We can see here the nurses that are really the category that mainly participated to that. They were very happy to do that. Also doctors or physicians work a lot on that. They are less happy on that, really. I tell you something about that, and all the others. Just a few comments on that. Nurses are, in Italy, happy about that, because the nurse category is a kind of category that is increasing in Italy, is increasing their social importance, their power inside the hospital, and normally they are very happy to work on that, because it's part of their behavior to work on the organization on that. Doctors are less happy, because normally they see on that a kind of deprivation of their own power, because normally the doctor has the idea that he's the boss anyway. In fact, the nurse by itself doesn't work for the doctor. A lot of people think that the doctor is the boss of the nurse, but it's not that. But the doctor thinks that he's that. And somebody has to tell them that. It's a continuous discussion. And the doctor sees that this is a kind of deprivation of their own power. And now we are doing a trade-off with the doctors, telling, I'll show you something, don't care about organizational power, it's not your job. Care about professional power. I take out to you a kind of power to organize beds and so on, but I give you something that will allow you to become a better doctor. Kind of training, kind of specialization, opportunities to learn something. This is the trade-off we are doing with our doctors. And giving to the nurses the power of this kind of organization. As you can see, it's a big change. It's also considering the high number we have. Another important thing is people. We ask a lot to our people, all the people. Doctors have seen, all the others. And again, we are in the public sector. It's also the motivation of people is something a little bit strange from a private company, so on and so on. And we put in place one comprehensive new approach of people management. And this is we are discussing also at the ministerial level in Rome, because this has been recognized a kind of best practice at Italian level, something that is put also with the minister to discuss new development of human resources in the healthcare system, public healthcare system in Italy. We started with the assessment competencies evaluation. We map, it's an enormous job, 1,500 people in the competencies. Everyone goes in this famous matrix, potential, performance. To do in a public sector, to do in a healthcare sector is, again, is a mess. Starting to understand how our people, mainly the doctors, everyone, which kind of competency has, and develop career development, develop personalized career development for people, develop, for instance, giving quality award for people that has good idea, promoting scientific activity. We tell everyone has to work in scientific activity to write papers, and the company gives to you time, some money, and opportunity to do that. This is part of the trade-off that I told you. I want doctors that become better doctor, that has to study and so on, and forget the power to bad management. That is the nurse work. We have put in place the talent project. Through this management review and so on, we select 10 people, more or less 10 people every year, to put in a 3 years path of development of competencies, going to understand, to better improve their techniques and so on. Again, also we have a stage and job posting. We declared that when there is an interesting job, before to hire somebody from outside, we offer to our people the opportunity to develop themselves. It's a policy, a declared policy, before when we find a lawyer, an engineer, a doctor, and so on, before to go outside, we look about our people and we develop the people. We help them to improve their career. And working also in the style and empowerment. Communication. We work a lot on that. When we started this project 5 years ago, I met personally all the 7,000 people. We did 70 conventions of 100 people each. They stay one day all together, mixed all together, from the driver to the surgeon. And I told them that we have to do this project, it's important, we have to do, because this is our future, their future, mainly. This is important because, again, I tried to say to our people that we have to do that. And this is very important because, to meet 7,000 people is not easy by itself, and to speak with everyone. Because at the end, also for instance, in the career development, because in the public sector is driven by a lot of laws, for instance, done by the government, so on, we are discussing with the people in Rome to try to have some kind of flexibility in put some good new idea in career development. Because at the end, the idea is this should be a company where is a great place to work in, plenty of opportunities. People, my ambition is people should want to come to our company because there is something to do. This is the idea that helps a lot in managing these programs. And one of the key of that helped me in doing this program is this kind of, let me say, of consistency, is kind of trade-off with people working with us. Otherwise, there was no way. This is important things. Few results, and I'm going to the end of this presentation. After that, you tell, okay, very nice, but which are the results? Results is in productivity. Look at that. In the hospital, our hospital, there were a turnover of 43. It means each bed processed 43 patients per year. Today, it processed 78, at the same number of beds, the same number of nurses, the same number of doctors. It means there is more and more production with an enormous absorption of the fixed cost. At the end, we had a mission, more or less 25% of production more with the same resources. Reduction from 10 to 18% of the length of stay in the hospital is an indicator of quality also. These are the results. In quality, this is a strange indicator, these days out of work, but somebody told me that is a quality indicator, and the lesser the better. We can see that also in this quality indicator we have a very good improvement. And because somebody says, okay, you look only at productivity and not at the quality. We are speaking about patient, not about other things. Also in quality terms, we have also in customer satisfaction, people we measure the customer satisfaction every year, and we have seen our patient really had a good appreciation of this new system. Again, some other activities production in these 5 years, we have an increasing of production of 30%, more or less, adding surgery with diagnostics, everything. There is a system to add everything. We have an increase of 30% of production. The people working on, they decreased by 6%, more than 6%, 6.5%, everywhere in each kind of doctor, nurses, and so on, mainly in the clerical people, admin people, when they decreased by 20%. These are, again, some of the results on that. Some other results, we reduced the standard procedures by 30%, the meters by 20%. Don't ask me how we measure, I don't know. Somebody told me that at 20%. I didn't go to measure, but they grant me that we reduced the meters by 20%. The warehouses was reduced by 45%. The paper form was cut by the half. The duplicated information, that is one of the problems in the hospitals, the continuous duplicated information was, again, 40% less. Few consideration. Is it easy? As it easy? Absolutely not easy. It has been absolutely difficult, is difficult again. Few comments on that. Some keywords on this job, really, that have you seen is broadly taking the company. Commitment, commitment, and commitment. This is work because of a lot of things, but one of the key factors is myself personally, I went to dozens of meetings in each occasion, in each opportunity I gave the message. I went, I met all the people of the company. Doing that is important. And it's important that the people understand that the director, myself, and all the direction of the people, the central staff, track the problem. Because one of the ideas was, okay, here's another flavor of the day, sit and wait, in a 6 month time, everybody will forget that. One of the typical approach of our people in the public sector, I think in many companies, to wait, sit and wait, do something, go to the meetings, and wait. And this is a typical approach. And when we started, after 2 or 6 months, the people start to say, but this is real thing. You are really to do. And this is important, the commitment. Another thing is the social technical aspect. Social technical aspect mainly with people of the high professionality, the doctors, but the top, the nurses, and so on. A strange kind of guys, it's not possible to say you have to do that and they do. Forget it. You have to take care to go to the motivation to the people that spent 30 years of career to reach one position, and now you cancel the position again. We have to take care about that and give to everybody motivation and respect. Because if you take care about that, really they can follow you. Otherwise, is in our sector, in healthcare and so on, with all the constraints that I've told you before. Credibility, the credibility of the company, on myself, for instance, because at the beginning of this project, I told to everybody, in meetings like that, I want to do this project, and if we don't do the project, I leave. If I stay, we do the project. I link my personal success on that project. And I told to the people, we have to do the project. This is not negotiable. What is negotiable is you have to do. You are the expert, please start to work on that. And I told to everybody that if the project failed, I will leave the company without problem, because I link my personal destiny to the project. But this has been perceived like a serious thing. And this is one of the, after 6 years looking at the past, one of the important things. It needs a continuous maintenance. I've seen today we have to work and work and walk, discuss, go to the meetings, have a lot of dinner with the people, trying, this is the part of the, and at the end there is one thing. In that job, but I think in all the job, 10% is inspiration and 90% is perspiration. We have to work a lot, and to discuss a lot. I think also in the industrial, everywhere is. Well, now I think I'm going to finish a couple of pictures about the people that work on. This is a selection of the hundreds of pictures we took during the job. And first of all, I remember always our patient, our customer, that is the guy that pays our wages through the taxes. And this is the end of my presentation. Thank you very much.